Uh, First of all, I will like to also acknowledge the presence of our Honorable Minister of Health of Tamil Nadu. His name is Mr. Ma Subramaniam. He is one of the famous politicians of Tamil Nadu, since we are all international delegates. He is one of the most active ministers in the state, a very big health enthusiast who has run hundreds of marathons also. All the leaders of the country actually look forward to him in terms of his fitness schedule and regime, etc. And I also thank Mr. Arvind for giving me this opportunity, and all the officers who are over here from Tamil Nadu government, and all the international delegates who are over here. So I am very happy to be amidst you on this occasion. I am Principal Secretary Health of the state of Tamil Nadu. I will like to say that it's a proud privilege that this international conference is being organized by WHO in Chennai, in Tamil Nadu. Perhaps because WHO also acknowledges the procurement procedures and methodologies of the state of Tamil Nadu. Mr. Arvind is heading the Tamil Nadu Medical Services Corporation. And this Medical Services Corporation is considered to be one of the most methodical organizations and agencies in terms of drug and medical equipment procurement. The organization was started in 1994-95, so it's almost 30 years now that the organization has been there. And this organization has almost a total of 1,206 staff. It's a big organization, 1,206 staff. That includes 521 permanent staff and 685 outsourced or temporary or contract staff. It's a big organization. You know, medical services, drug procurement and procurement of medical equipment is not an ordinary procurement process. It is a technical process. We need to have technical persons over here. We need to have a mix of technical experts as well as the financial experts. So we are having in the Medical Services Corporation, of course, the managing director, and I being the chairman of this organization. We are bureaucrats. We belong to Indian Administrative Services. But beyond us, we are all having experts from biomedical engineering, engineering departments, the experts from civil services of engineering and medical services, and drugs department, etc. So it's because of this combination over here, we are able to procure in the state nearly 95% plus requirement of our medicines and equipment, not only in the health department, but also in our veterinary sciences and municipal corporations, municipalities, etc. The drug related issues we are able to procure through the Tamil Nadu Medical Services Corporation. I am just giving you a feel of this organization, why your conference is being held in Chennai, because tomorrow when you are going to see the Tamil Nadu Medical Services Corporation, you will actually understand the deep analysis that the corporation does before procurement of drugs as well as the medical equipment also. So the corporation procures nearly 338 essential drugs which are needed for the citizens. The population of this city is 800, that is almost 80 million population is there. And there are a total of 105 surgical consumables which are procured every year, 189 suture consumables, 301 specialty drugs and 202 veterinary drugs that are procured every year. They are all very busy people. In fact, there are a few people who are sitting in this first bench. They are either the part of the organization or part of the procuring agencies. But I am amazed by the way that they do the procurement and procurement is entirely transparent. Nobody can influence the entire procurement process. That's the system that is followed over here. It's not just the procurement of drugs and medicine and the consumables. The Tamil Nadu Medical Corporation, because of its expertise, also helps in running the specialty machines in various medical colleges and hospitals across the state. And that includes 190 CT scan centers, which they themselves run and maintain. We charge small amount from the people. 33 MRI scans in 32 locations. 6 MRI scans are run on PPP basis. The other MRI scans are procured by us, but on public-private partnership basis also, the 6 MRI scans are run. 2 PET CT scans are run on PPP basis. 3 lithroscopic machines are run. 9 linear accelerators and 10 cobalt units. I'm just giving you a feel of what all is being done by the Medical Services Corporation. The Tamil Nadu Medical Services Corporation also procures the manpower that is required for day-to-day maintenance of the hospitals, the co-workers, the workers who are employed in the sanitation process, etc. So all across the state, the medical colleges, the hospitals, in all these hospitals and medical colleges, the staff that are required to maintain the sanitation system, to maintain the cleanliness of the wards, etc., is being maintained by the Tamil Nadu Medical Services Corporation. This corporation also runs 7 pay wards in the hospitals, city hospitals. So in the pay wards, actually the people can pay much smaller amount as compared to the charges that are there in the private hospitals, and have equal or perhaps better facilities than the private hospitals in terms of treatment. Because as you might have understood, the governmental health system, doctors' quality, the doctors' knowledge and quality is definitely better than the private system, private network, because the doctors see a large number of patients. It is those I want to have a treatment. I also want to have an exclusive room like a private hospital. I can go to the pay ward, pay a small amount of money, and have the treatment to the best doctors and paramedical staff that are available in the country, in the state. So all this point of introduction, I thought, I was not there in the beginning of the tenure. I thought I should mention over here as chairman of the Tamil Nadu Medical Services Corporation, because we are all proud of the services provided by the Tamil Nadu Medical Services Corporation. Many a times we get calls from countries abroad, including we have had a lot of inquiries by countries like Maldives, to procure the drugs and consumables and give it to them. And so that's the standard. Many states, they send their doctors and officials to Tamil Nadu Medical Services Corporation to learn from how the procurement system is there. I will end with 2 points. First, about the commitment of the officials. Just 2 days back, there was a board meeting of the Medical Services Corporation, wherein we had to decide about the agenda of procuring the medicines and drugs. The board meeting started of course we had to start a little late, started in the evening at around 6:30 and ended in the night at 12 a.m. So that's the commitment of all the people who are over here at this point of time. And the last point I would like to say that we are very proud to have the speaker after me, the Honorable Health Minister of Tamil Nadu, Mr. Ma Subramaniam, a very dynamic minister, hands-on. He allows the corporation to run with a free hand. He doesn't like any interference by anybody. So this is to all the WHO officials, that if there is a combination of 3 factors, good systems like in TNMSC, good officials like the people in the first bench, and good political system with ministers like the one who is sitting over here, definitely we will always be a role model in the entire country. Thank you.
Sir, thank you very much for the appreciation which you showered on my team as well as on TNMSC. Thanks. As Health Secretary himself said, he is not just the Secretary of the Government of Tamil Nadu for the Health Department, he is also the Chairman of the Tamil Nadu Medical Services Corporation. And with this great support, we have been able to perform what we are seeing now in the medical services, drugs as well as equipment in the state of Tamil Nadu. Thank you very much, sir. Now coming to our next speaker, Honorable Health Minister of Tamil Nadu. As Secretary sir already briefed you, he is a well-reputed, well-renowned marathoner. He has run more than 120 marathons. I think sir has maximum run for about 21 kilometers at a stretch. As district collector, I have seen him in one of the marathons. So sir is a very and promotes fitness amongst public also. Now we have recently introduced in the government program 8-kilometer health walk, which will be done in all the districts in the state of Tamil Nadu. We have 38 districts in the state. Each and every district will have a 8-kilometer stretch where people will be encouraged to walk, which is because of, as you all know, because of changing lifestyles, we are having a lot of NCD issues, non-communicable diseases issues in the state, across the country, across the world, and this is the one major step which Honorable Health Minister has brought in our public health sector for improving the health of the public. Now I request Honorable Health Minister of Tamil Nadu to address the gathering and offer your obeisance. Thank you.
Good morning to all. At first I welcome the Director Health Systems WHO, Principal Secretary Health and Family Welfare Department, MD TNMSC, PD TNH SRB, Ms. Kim WHO, Mr. Terence WHO, participants from Bangladesh, Bhutan, Indonesia, Maldives, Nepal, Sri Lanka, Thailand, Timor-Leste, UNICEF observers, Vanakkam. It is my privilege to address this gathering of international procurement agencies, and I am glad to note that the World Health Organization has chosen Chennai as the preferred location for this workshop on improving access to medicines. It gives me immense satisfaction to note that the WHO Zero has chosen our TNMSC as a base for this workshop. I must place my appreciations to my health department and TNMSC. On behalf of the state government and the Honorable Chief Minister of Tamil Nadu, I warmly welcome the delegates to this international workshop. The government of Tamil Nadu has always placed great importance to the development of public health and medical systems in the state. A good public health system relies on three pillars: medical doctors and staff, physical infrastructure, and timely and quality medical supplies. The crucial task of ensuring timely and quality supply of drugs, equipments and other medical supplies have been entrusted with the Tamil Nadu Medical Services Corporation since 1994. TNMSC is an ISO 9001 2015 certified organization, and all procurements are done in an open, transparent manner under the Tamil Nadu Transparency in Tender Act 1998. TNMSC has an efficient drug distribution system supported by a robust software called the Drug Distribution Management System. The DDMS offers end-to-end computerization of drug distribution from procurement, quality assurance, drug distribution to vendor management, and by which drugs are distributed to about 2,000 government health facilities across the state through 32 drug warehouses. convinced by the transparent and efficient style of procurement of TNMSC. Many state governments in India have tried emulating the model of TNMSC in their respective states. Also, international agencies like the World Bank and the JICA have recognized TNMSC as the procurement entity for their projects in Tamil Nadu. The government of Tamil Nadu has been a pioneer and a role model for other states in India in implementing development schemes in the public health sector. The schemes introduced by us have been recognized and later adopted by the Government of India for emulation. Very briefly, I would like to name a few flagship schemes. The Chief Minister's Comprehensive Health Insurance Scheme, which was introduced in the year 2009, aims at providing cashless treatment for poor and low-income group families to get good quality medical treatment in private hospitals also. This scheme was later adopted by the Government of India in the year 2018 as the Prime Minister's Jan Arogya Yojana. Realizing the need of pregnant mothers and nutritious diet and for improving the birth weight of babies and reducing IMR and MMR, the government is implementing Dr. Muthulakshmi Reddy maternity benefit scheme since 2006. This noble scheme has also been adopted by the Government of India only for prime mothers through the Pradhan Mantri Matru Vandana Yojana in 2010, recognizing the need of managing non-communicable disease effectively. The government introduced the Makkalai Thedi Maruthuvam scheme by which people are screened for NCD and drugs are provided to them at doorstep, which is a noble objective to reduce mortality in road traffic accidents. The state government is implementing Innuyir Kappom Nammai Kakkum 48, a cashless and free emergency medical treatment scheme for all road traffic accident cases for the first 48 hours. The initiatives taken up by the state of Tamil Nadu over the last 5 decades have greatly reduced the MMR and IMR indicators. And I am proud to state in this August forum that the state of Tamil Nadu has already achieved the Sustainable Development Goals for 2030 in respect of MMR and IMR. On behalf of the state government, I assure the World Health Organization that the government and my team will continuously strive to improve the public health of the state and the well-being of the people of Tamil Nadu. I once again thanks the WHO for giving me this opportunity to highlight the good strides we have taken in the field of public health in Tamil Nadu. Thank you.
Thank you, Honourable Minister, the Secretary, Mr. Arvind from TMNC and the TMNC family here, and welcome participants again. So yes, indeed, it's quite inspiring to learn and hear about the wonderful health outcomes and then the great work that has been going on in Tamil Nadu. And thanks to Tamil Nadu Medical Service Corporation, I think this we often forget, we often commend the great work and the outcome, but we sometimes forget that there is so much effort that has been put into this to make things happen. And this is exactly the reason why we chose our first regional meeting on public procurement agencies to be in Tamil Nadu and to collaborate with Tamil Nadu Medical Service Corporation, because at least for me, in my 25 years of career on access to medicines in low and middle income countries, I have read so many articles how Tamil Nadu has excelled. And there's a lot of study tours to come to Tamil Nadu and to learn. However, I think it was just a wonderful opportunity that the Southeast Regional Office of WHO is based in India, and we are able to choose Tamil Nadu as the first location to learn and to also give the opportunity to our member states to come here and see for themselves. Because of course we could read articles, we could read reports, but there's nothing better than actually to come here in person and see it. So we really look forward to our field visit tomorrow, and thanks so much to Tamil Nadu Medical Service Corporation for organizing that. And that will really help us to connect how the operations actually lead to better health outcomes here. So thank you so much, the Minister and the Secretary, for taking your time in your very busy schedule. And that really shows your commitment, how this area of work is so important. Thank you so much again.
So, thank you very much. Can we have a group photo? I think we'll come, can those who will help us arrange the seats here so that we can all have a workshop group photo. Let's all come this side. Maybe we need some chairs in front. Can we all come this side? We have others that can come stand. I think the photographer can help us. Yeah.
Coming to international bank.
Okay, we can come stand. The taller ones maybe at the back. Some may stand on the podium.
Wait for the channel. Sir, கொஞ்சம் பேக்ல வெயிட் பண்ண சொன்னா சார் வெயிட் பண்ண சார் கொஞ்சம் பேக்ல வாங்க எடுத்துட்டீங்களா ஓகே எடுத்துட்டீங்களா இங்கே எடுக்கிறேன் தேங்க்யூ சார்